Hello everyone. So in this video I am going to talk about the bronchopulmonary segments. Okay, I was also explain about bronchopulmonary segments, what is it, okay, how to draw in exam, okay, what is the difference between right lung and left lung, the anatomy of the lungs. Okay, these all things are all I explain into the part 1 video. Okay, now we start up with the part 2 of the bronchopulmonary segments and the how to write this question answer into the exam. So first of all we start with definition. So what is bronchopulmonary segment? Short form is BPS. Okay, so these are well defined anatomical, functional and surgical sectors of the lung. Okay, it is anatomical, functionally it is also important, and surgically it is also important. So that's why it is well defined anatomical, functional and surgical sectors of the lungs. So it's all about definitions. Then you started with the features. Okay, first features, each segment is pyramidal in shape with its apex directed toward the root of the lung. Okay, so understand this sentence by a diagram. So see here, it's one segment. Okay, so I am taking a one segment. Okay, so like this. Okay, like this. So here it's apex of the segment, and this apex of the segment is lie toward or directed towards the root of the lung. So the sentence is what? Each segment is pyramidal in shape. It is a pyramidal in shape with it apex. It directed towards the root of the lung. It is a root of the lungs. Okay. So the first point is clear. Second point, each segment aerated by segmental bronchus. Okay, each segment aerated by segmental bronchus. Segmental bronchus, that means a tertiary. Okay, tertiary bronchus. So let's understand this sentence. See here, it is a bronchopulmonary segments of lungs. So here it is a trachea, and trachea further divide into the primary bronchus. Primary bronchus divide into the secondary bronchus, and secondary bronchus is divided into the tertiary bronchus. Okay, so these all are a tertiary bronchus. Okay, so 10 segment is on the left side and 10 segment is on the right side. Each segments of this tertiary bronchus, which is supplied a single segment of the lungs. Okay, so this is about the bronchopulmonary segments of lungs. See here in diagram, the first three, 1, 2, 3, which supply the right side upper lobe, 4th and 5th supply middle lobe, 6, 7, 8, 9, 10 supply lower lobe, left side 1, 2, 3, 4, 5 supply upper lobe, and 6, 7, 8, 9, 10 supply lower lobe, because left side no middle lobe is present. Understand? The third point, each segment has a bronchus, segmental artery, autonomic nerves and the lymph vessels. Okay, each segment has their separate bronchus, segmental artery, autonomic nerves and the lymph vessels. The segmental venules lie in connective tissue between adjacent pulmonary units of bronchopulmonary segments. Segmental venules, okay, that lie between a connective tissue of the pulmonary units. Okay, so the bronchopulmonary segment is not a bronchovascular segment. Okay, because it has not a own veins. Okay, bronchopulmonary segment doesn't have its own veins, so that's why we don't say it is a bronchovascular segment. Okay, so this is a fifth point. Bronchopulmonary segment is not a bronchovascular segment because it doesn't have its own veins. So for this bronchopulmonary segment answer, you have to write first definitions, then its five features. Okay, then you have to draw this diagram into the exams. Okay, which I previously explained in part 1 video. Okay, how to easily remember and how to draw this diagram into the exams and how to give a number. Okay, so see here a bronchopulmonary segments as seen on costal surface. Okay, in that the 7 number segment is not seen in right lung as well as in left lung. Okay, see here 1, 2, 3, 4, 5, 6, 8, 9, 10, but 7 is not seen. 1, 2, 3, 4, 5, 6, 8, 9, 10, 7 is not seen. Then the bronchopulmonary segment as seen on mediastinal surface of the lung, left and right side. Okay, so the number 4 segment is not seen on right side. Okay, here the number 4 segment is absent in right side. So see here it is a left lung because it has a lingula, or we can say cardiac notch. So it is a left lung. Here it is the right lung. So here in left lung all segments are present, 1 2 3 4 5 6 7 8 9 10. But in right lung number 4 segment is absent, 1 2 3 5 6 7 8 9 10. Okay, so for understand this and how to draw it, you can visit my part 1 video. Then you have to write about the names of bronchopulmonary segments. Okay, so right lung and left lung, this also I explained before. So right lung has 3 lobe, upper lobe, middle lobe and lower lobe, because right lung has only 2 fissures, that is oblique and horizontal. So that's why it has 3 lobe, upper lobe, middle lobe and lower lobe. Left lung की हम बात करें, so left lung has only 1 fissure, that is oblique fissure. So that's why it's divided into 2 lobe, upper lobe and the middle lobe, upper lobe and the middle lobe. Then segments. So each lung has 10 segments, 10 here, 10 here. So upper lobe has 3 segments, that is apical, posterior and anterior segment. Middle lobe has 2 segments, lateral and medial. And the lower lobe has superior, medial basal, anterior basal and lateral basal and the posterior basal segments. Then we talk about the left lung upper lobe, which is further divided into the upper division and the lower division. Upper division has 3 lobe, apical, anterior, posterior, same like here. Okay, apical, anterior, posterior, apical, anterior, posterior. Here also lower lobe also have a same segments, superior, medial basal, anterior basal, lateral basal, posterior basal. See here it is also same, but the difference between in left lung, due to the presence of lingula, you have to write about 2 segments, that is superior lingula and inferior lingula. Okay, and the left lung has no middle lobe, so this is not including left side. Okay, so this is all about the names of the bronchopulmonary segments. This chart is you have to write down into the exams. Then again one diagram which I saw before. So this diagram is also you have to draw into the exams. So this is all about the bronchopulmonary segments and how to write the answer of this question into the exams. So if you like my video, share it and subscribe it. Thank you.